Hello everyone, let me introduce our electronic infusion pump, BIOTEK. The product consists of electronic control component and liquid storage component. The liquid storage component is made of silicone and PVC material. It has three working modes like continuous infusion, patient control analgesia and continuous infusion plus patient control analgesia, with intravenous or epidural infusion routes. Used for continuous pain management, patient control analgesia, postoperative analgesia, painless delivery, chemotherapy through intravenous and epidural infusion. 2. Features. 1. Clamp. When the electronic infusion pump makes alarm, close the clamp, which can effectively stop the infusion. 2. Unilateral valve. Prevent backflow of blood. It can effectively prevent the blood from backflowing into the pipeline. 3. With special carrying bag for the pump. 4. The pump has built-in 5 audible alarms: air bubble, low battery, blockage, locking, over limit, which can effectively prevent infusion accidents. 5. The electronic control component is equipped with advanced imported chips, with accurate flow rate and stable performance. 6. The liquid storage component has 100 ml and 200 ml volume available, to meet the request of different operations and patients. 3. Instruction for use. Step 1. Unpack the liquid storage component, take out the medicine box and accessories, do not pull out the white key. Then inject the prepared medicine into the filling port. After the injection is completed, place the medicine box in the direction of the arrow marked on the medicine box. Use a syringe to exhaust most air inside the medicine bag, and clamp the clip after the air bubbles are exhausted and connected to the port of infusion pipeline, which is far from the unilateral valve. Step 2. Take out the electronic components, open the battery cover. Install 4 AAA batteries according to the positive and negative poles of the battery and close the battery cover. The green light indicates that the pump is normal and ready for use. Step 3. Remove the key, assemble the liquid storage component to the electronic control component. And rotate the key at 90 degrees in the locking direction to lock it. Step 4. Power on. After the liquid storage component is connected with the electronic control component, press the power button. The electronic infusion pump emits a bleep sound D. The screen lights up and displays the factory settings. Step 5. Air exhaust. Open the clamp, observe if any leakage from the liquid storage component to prevent it flow automatically. If any leakage, do not use. Press the exhaust button to exhaust the air in the liquid storage component and pipelines again to prevent remaining air. Meanwhile, the word exhaust appears at the bottom right of the screen. The pump begins to exhaust air automatically, and then observe until no air bubble inside pipeline and medicine flows out normally. After the air exhaust is completed, and the word exhaust disappears on the screen, If you need to stop the exhaust when operating, only need to press the exhaust button again. Step 6. Parameter settings. Press the flow rate button in the unlocked state to set flow rate within the range of 0.5 to 9.9 ml per hour. Press this button once to increase the flow rate by 0.5 ml per hour, but an increase of 0.4 ml per hour from 9.5 ml per hour to 9.9 ml per hour. Press the flow rate button for 3 seconds. The electronic infusion pump emits a bleep sound D, and the maximum rate value flashes. The max rate can be set within the range of 5 to 100 ml per hour. Press this button once to increase by 5 ml per hour. Press the flow rate and exhaust buttons in the meanwhile for 3 seconds. The electronic infusion pump will emit a bleep sound D and the infused volume value will flash, for switching of nominal volume. The nominal volume can be set in 100 ml, 150 ml and 200 ml. Nominal volume means how much medicine needs to be infused. Press the PCA button to set the PCA volume within the range of 0.5 to 9.9 ml per time. Press this button once to increase the PCA volume by 0.5 ml per time, but an increase of 0.4 ml per time from 9.5 ml per time to 9.9 ml per time. Press the PCA button for 3 seconds, and the electronic infusion pump emits a bleep sound D, which can set the PCA times within the range of 1 to 20 times per hour. The relationship of flow rate, PCA times, PCA volume, as following format: flow rate plus PCA volume multiply PCA times less than max rate plus 1 milliliter. Step 7. Start. After setting the flow rate, PCA volume, and PCA times, press the start button to make the machine running. At the same time, the electronic control component program locks the flow rate button, PCA button, power button, and start button. The word Run appears in the lower right corner of the screen and flashes, and the electronic control component enters the running state. Step 8. Power off. Press the flow rate and PCA buttons simultaneously for 3 seconds. After hearing a bleep sound D, electronic control component program is unlocked. Then press the power button to power off the pump.